Hi there, and welcome to Elevator Pitch Economics. In today's video, we're going to go through the evidence behind the behavioural model on obesity. And to do so, we're going to use a paper by Kang, Ikade, and Otake from 2010. In a previous video, we talked about the theory behind the behavioural models of obesity, and then we discussed the three aspects, which were time discounting, also known as impatience, hyperbolic discounting, or inconsistency, and the sign effect, or future care. In this video, we're going to look at whether or not there is evidence to support this, and to do so, the paper by Ikeda, Kang, and Otake use survey data from Japan. Now, Japan is like many other developed countries. It has faced a rising rate of obesity, but it also has a high proportion of underweight individuals. For example, 1 in 5 Japanese female adults in their 20s is underweight. The data which is used to support the analysis is from the Japanese Household Survey on Consumer Preferences and Satisfaction from 2005. And in order to elicit discount rates from respondents are asked to choose between A and B, where A and B are two different sets of money. So for example, they will ask respondents, would you rather receive 10,000 yen in 2 days or 10,096 yen in 9 days? Would you rather receive 10,000 yen in 2 days or 10,574 yen in 9 days? And their response is used to elicit individual interest rates, which, as I mentioned in a previous video, is a proxy for discount rates. In order to ensure the accuracy of the discount rates, they use different variations of the question. So for example, in the previous example, we showed how they varied money amounts between A and B. They also vary the time horizons, the time delays, the receipt of payment, and ask a separate question for individuals as to what interest rate is needed to delay a 1 million yen payment for 12 months. And all 5 questions are used to calculate individual discount rates. They further ask respondents questions on whether or not they hold debt, how quickly homework is completed as a proxy for procrastination, and what probability of rainfall is required for respondents to bring an umbrella, which is a proxy for risk aversion. And on screen are the results from their regression analysis. What they've done is they've used regressions to check if there's a statistically significant relationship between BMI and the aforementioned variables, and the relationship between the variables and the probability of someone being severely obese and underweight. So what were the key results from the analysis? Well, the signs of the variables were very much in line with what we would expect. Those who have higher impatience have higher BMI. Those who have hyperbolic discounting tendencies also have higher BMI, although that was noted as statistically insignificant. Those who observe the sign effect have lower BMI, whereas those who hold debt and those who procrastinate have higher BMI, and those who are risk averse have lower BMI. And these results also hold when we test them on the probability of obesity. Now, one thing to note is that the magnitudes, both in terms of the effect on BMI and the probability of obesity, are relatively modest. For example, it was noted that one higher unit degree of procrastination implies only a 2.8 percentage point probability increase of being obese. And when it comes to the probability of being underweight, there was evidence that those who show signs of the sign effect have a higher probability of being underweight, but that was only for females and not for males. So the theory is in line with the evidence. Generally, those who show signs of impatience will also show signs of higher BMI and the probability of being obese. Whilst hyperbolic discounting is positively correlated as well with high BMI and a high probability of being obese, it's statistically insignificant in the analysis, which means it's quite inconclusive. Whereas with the sign effect, those who show the sign effect do have a lower BMI and a lower probability of being obese, but it's also associated with a higher probability of being underweight, especially for females. Now, what are the policy implications of the paper? Well, one thing to note is that, unfortunately, it will be impossible to target individuals based on their discount rates. For example, it will be very difficult to elicit discount rates for the entire population and then introduce a obesity reduction strategy for those who have specific behavioral tendencies. For example, how do you target individuals who have impatience, and how do you target individuals who show signs of hyperbolic discounting? So one thing you can do, which the paper proposes, is to raise the immediate cost of choices which lead to obesity, such as introducing taxes on sugar or taxes on fast foods. Now, these have been introduced previously, especially in the United Kingdom, but they were met with widespread hostility and protest. And the protest was from both consumers and the food industry. For example, the UK tried to introduce a tax on certain foods, which became known as the pasty tax, and that was met with incredibly widespread hostility, especially from those who were selling baked goods. Another policy idea which the paper proposes is to use something called a nudge technique, and these are very popular in behavioral economics. The general idea behind a nudge technique is to prompt or give small nudges to individuals to ensure that they elicit certain behaviors. And an example of this in the food industry would be to ensure menus or menu screens only have healthy foods on the first pages. So when a customer comes in to say McDonald's, the very first thing they see on the menu screen are healthy foods only. And if they want, for example, to see the unhealthier burgers or unhealthier nuggets, etc., they would have to either ask the person at the desk, or it would be in a much smaller place, not the kind of place which would be the first thing you would see when you walk into McDonald's. The other ideas you can do are regulate food advertising and reduce the amount of vending machines in, say, an office. But again, these ideas are very likely to be met with hostility, especially from the fast food industry. Along with that, they'll be very difficult to implement. For example, what rules do you place on the number of vending machines you can have in an office? And how do you regulate the rules behind what's healthy and what's not healthy on menus? One of the final ideas that the paper proposes is to promote policies which improve self-control. Say, for example, increasing education on self-control. Now, this might help, but one of the adverse effects could be an increase in the number of females who become underweight, because it could increase the sign effect in the population. If you found that video useful, please give it a like and feel free to subscribe. Let me know what you think in the comments.